that actually makes sense, right? Like it doesn't make sense to have like a cholesterol thing with that also has glucose support in it, or a multivitamin that also happens to have a little bit of like other stuff. Like it just kind of, it doesn't muddy the water, right? It makes things very cut and dry, I think.
Welcome back to another episode of the Peak Performance Life podcast. Today, we have my good friend, Dr. Chanu Dasari, and he is back for his third time on the show, which is the most, I think. We don't, no one, so you're in first place now in terms of returning guest, third time on the show, and I hope that we can do it a lot more. There's a few people like yourself that I loved speaking with, I love hanging out with. We always talk about really cool health stuff, and I'm always like, man, we should record that, those conversations. So I think it's great. There's only so much talking to myself that I can do on these podcasts. So it's great to have someone who's super knowledgeable and brings amazing knowledge to the table. So thank you so much for coming back.
Thank you, Tulor. I appreciate you having me.
Absolutely, man. And so on the first couple episodes, we've talked about Chanu is a expert in he treats a lot of patients. Actually, he's actually a gut surgeon, but if you remember the previous episode, we actually called him a holistic gut surgeon, holistic health practitioner. So which is rare. You don't see surgeons too much that are kind of into holistic health and nutrition and diet and even, you know, mindset stuff, which we may have time to get into later on the episode. Some things about how trauma and things like that can affect cause or affect, you know, autoimmune diseases and different things. So why don't we just give a quick recap? Because I know you work with a lot of people who have different diseases. You know, let's talk about autoimmune disease. You have lots of videos on YouTube. You have a YouTube channel that's going viral, going crazy. What are some of the top autoimmune diseases? And then we'll talk about like nutrition and stuff like that after.
Yeah, so a little bit about my background. Obviously, I'm a surgeon, but I myself used to have inflammatory bowel disease and autoimmune disease. And this was something I fixed almost 15 years ago and then didn't think about it. And then when I got into my practice, I started seeing a lot of these patients and I started giving them the same suggestions that I had always followed. And just recently in the last year, we basically put together a comprehensive program that people can get results in about 6 weeks. I'm talking about full reversal of their autoimmune disease in 6 weeks. And we're not talking with, you know, pills or medication. We're talking about with, you know, diet, digestion, sleep, stress, exercise, and obviously supplements are a big part of that. And I'll just let you know, like my track record is very good. Like even in the last, I don't know, in the last 8 months, there's just a bunch of people, like you'll see the YouTube videos of people saying like, hey, I fixed my autoimmune a year ago and things like that. And it shouldn't come to a surprise because most people who have had autoimmune disease or had inflammatory disease or digestive dysfunction, they have had the same genetics during childhood when they never had these problems, right? So it's easy to blame genes, it's easy to blame these things, but really it comes down to gut microbiome dysfunction. And in order to treat those sort of problems, you need to not only be smart about what you do, but, you know, some kind of, you know, being smart about supplementation and those 5 pillars that I talked about: diet, digestion, sleep, stress, and exercise. The conditions I look at right now in my clinic are all autoimmune conditions, but I focus in on about 10 conditions, which I think are very high impact and they're very common. So example would be lupus. And along the lupus spectrum, you have anybody with ANA positive disease. So that would include people like Sjogren's, mixed connective tissue disorder. I have people with digestive dysfunction, so IBS, SIBO, Candida. I recently released a video of a few people that reversed their Crohn's disease within 6 weeks. And then so I started getting a bunch of ulcerative colitis and Crohn's patients. Same goes for rheumatoid arthritis. I've got quite a few rheumatoid arthritis patients, eczema patients. And I hate labeling patients by their disease because after about like month 2, I just have to call them patients or friends at that point because there's not a whole lot that I'm doing. You know what I mean?
Yeah.
So I should just say former autoimmune disease patients at this point. But so, and then we cover.
And actually, that's important that people don't identify with their disease. Like I've actually met quite a few people who are like, I have Hashimoto's, I have this. Oh, I just have to learn to live with this. And then like we'll go out to eat and they're like eating French fries and drinking a beer. And I'm like, okay, like, you
That's
know.
what's causing it, you know?
Yeah.
Yeah, so we also see MS patients, fatty liver patients, psoriasis patients, you know, you name it. And it's just the full gamut of autoimmune disease and digestive dysfunction. I just want to just be very clear that, you know, we see a lot of gut dysfunction. Fatty liver is very common. It's becoming a big problem in this country. It's the #1 cause of liver transplants now. And so it's there's a lot there, and all of these fall under the umbrella of inflammation, as you know. And we also know that most inflammation, because 90 or 80% of the immune system is in the gut, it's caused by microbiome dysfunction. So, you know, you talk to someone like me or other physicians like 10 years ago, we wouldn't have told you that, right? Because all this data just came back in the last 10 years. And we're starting to find actually almost 30% of inflammation, autoimmune disease, digestive dysfunction is actually tied to trauma. And I'm not talking about trauma with a capital T, but I'm talking with trauma with a lowercase t. So not, you know, some people, they just are, they don't even know themselves, right? And it's just, it may be one experience, it may not be, right? So trauma with a capital T would be like a death of a loved one or abuse or, you know, these are very traumatic type experiences, right? The things you normally associate with trauma. But the interesting thing is, like, when you look at trauma with a lowercase t, these are like more subtle, less memorable, seemingly ordinary events. And maybe it was the way how you were raised or your cultural beliefs, what your parents valued, you know, and what it causes is like a disconnect from yourself, right? And it affects nearly everyone. I'm talking 99% of folks. For example, like when you're kids, like, right? Kids are praised for good behavior and they're shunned for bad behavior. Right. And I'm just giving a basic example here, just so people can sort of understand where I'm coming from on this. So what that teaches the child, though, is that they're loved only when they're doing good. And they're not as loved when they're expressing negative emotions or bad behavior. And you know, another example is we live in a materialistic, capitalistic society, right? And if you work really hard all day long just to afford to buy things, we focus a lot of our energy and resources on those items, right? And so what do? We praise workaholic behavior. We praise hustle mentality. And you know, and I'll give you a third example, right? Like maybe we were raised not to offend anyone, right? And so that's something like, you know, maybe you are going to now be polite. You're encouraged to fulfill a duty, be super responsible, right? And keep in mind, these are like things that are praised in our society, right? And this, we can include people like family members, friends, coworkers, social acquaintances, the list goes on and on. And if you look at what this does is you may end up with certain types of relationship dynamics as a result of those sort of ingrained behaviors, right? So we feel bad when we don't do these things, and we perceive that there's going to be a negative consequence resulting from it. And so we're, you know, it's not us misbehaving or crying now, it's just us just spending a majority of our day doing things in pursuit of these goals, which are not really fulfilling our unmet needs, right? And we have a lot of unmet needs, right? Our unmet needs can include a lot of things, right? It's there's a lot there, right? We may have unmet needs for intimacy, outdoor activities, time spent in nature, spiritual exploration, exercise, nutrition, right? Like how many people have you met that say, I don't have time to plan out my nutrition or plan out my meals so that I actually get what I think I ought to have, right?
Yeah.
Self-care is another big one, right? Like some people don't have enough time to moisturize their feet or floss or, you know, just like basic sort of things. Rest is another one, right? How many people are just exhausted and they just need rest, right? Creative expression, artistic consumption, right? A lot of times we're just brainlessly watching the TV when it's like, you know, in your back of your mind, you're like, man, there could be some better time spent this way, right?
Yeah.
So we're doing more exploration on that. We're adding an entire module to the, so I have a program that reverses autoimmune and digestive dysfunction. we're adding an entire trauma piece to it to try to fix those issues. And it's been great. I've worked with a it's an awareness coach. She's not a counselor, actually. I'm not so keen on counseling because, at the end of the day, it doesn't really matter where these thoughts and behaviors came from. It's more important, I think, to identify how these are affecting your current decision making.
Yeah.
And so I think an awareness coach is probably better for those. And we have one as part of our program, which is amazing, right? That she does wonders with folks. She's worked with me personally, even though, to Laura, like I'm very healthy right now. I don't take anything really. But I still, some of these sort of thought processes, right? Like maybe we should work more, maybe we should do more,
Absolutely.
right? Be more productive, be more responsible. These sort of things are just lurking in the background, right? And so it's very important to kind of understand how these things play out. And so, yeah, I've had a very good experience working with her, and now she's working with folks in the program, which is amazing. And I think for anybody that's really looking to reverse autoimmune disease in a short period of time and really give it a shot, I think they're gonna like it.
Yeah, man. We'll probably circle back to the deep trauma stuff here, but
there's a lot.
There's a lot there. I think we'll circle back to it. But everything you said completely resonates with me. The listeners know that when I had massive pain and inflammation in my arms, point where I had to use a voice dictation software for 2 years. And, I say that the way I healed myself was exactly the two things that you spoke about. So there's the inflammation part of inflammation is caused by what you put in your body, right? So the first thing you have to do is stop eating inflammatory foods, sugar, alcohol, fried foods, all that kind of stuff. Right. Which I want to hear you're more detailed about supplementation and nutrition here in a second. But the second part is so once I did that by kind of going on a paleo, low inflammatory type of diet, so I got that part down. Then there's also a mindset part, right? And for me, Dr. John Sarno is really famous for this. In fact, it's my podcast episode that has the most downloads. Amazingly, it has tons of downloads. I guess a lot of people, are searching for him and want to hear people's experiences. But for me, being a very driven entrepreneur, right? Even now, right? Like, how do you balance spending time with your kids, right? Going to the gym and taking care of your health and working and, and I want to do better I want to be more successful. I want to help more people. It's what do I do? And so I get it. Like we certainly get it, but yeah, understanding. And the biggest thing John Sarno helped people realize was that, and now he has a lot of certified coaches and stuff like that too, which I'm sure do very similar stuff to what you guys are talking about, but it helped me realize there was nothing wrong with me. Right. So I kept thinking there's something wrong with me. Like I got to fix it. I'm up late at night looking for a pain relief cream or pain relief device because I need to find something that's going to heal me because I have this problem. Right. And, he basically said it's very common with driven entrepreneurs, this inner tension, I gotta succeed. I gotta get this done. I'm going to push and grind through it. And literally I used to grind my teeth. I don't think I do anymore, but I know I used to. Right. And so there was literally this inner tension that can cause a lack of oxygen or cause inflammation in certain parts of the body. And when it was oh, wait, I'm okay. There is nothing wrong with me. Actually, this is just if I just chill out a little bit and learn how to, get more into personal development and spirituality and coaching and have people help me. So that was also, I say there's the mindset and there's the health aspect. So let's start with, I don't know if you have any comments on that, but then let's start with your nutrition aspect of it.
Yeah. I just want to make one comment. Yeah. Everyone is deserving of love.
Yeah.
You don't need to earn it. Right. This idea that you have to change yourself or you have to fix yourself, right? There's something wrong with you, or you have to be productive or do something or be responsible or do something in order to be loved or earn the affection or just be deserving of that love. I think that's the important mindset shift. I think everything starts from there. Right. And then when you move past that, then you can start making these really great decisions for yourself, right? You can start fixing things like your diet, right? Because all your assumptions about why you couldn't do it before are gone now, right?
Right.
You start fixing your diet. And that was the first thing we bonded over, right? Was how you fixed your own issues with inflammation. I mean, that was how we became
Yeah.
friends, right? That was the first conversation we had, actually. And
Yeah.
and
And real quick too, I want to mention something there. Like Tony Robbins talks a lot about like what question are you asking yourself over, and what is, like, you know, the voice in your head, what is it saying over and over? And so I remember when I was in that state, I bet a lot of people now who have like chronic pain or have one of these autoimmune diseases, they're like, you know, why is nothing working? Why am I feeling so bad? What's wrong with me? What's, you know, and so like it's the wrong question, right? And so like if you're asking, if you have the same loop in your head about what's wrong with me, why can't I get better, this and that, versus like, you know, okay, I know I can get better, other people have gotten better, you know, Chanu's helped, you know, hundreds of people get better and reverse their autoimmune disease. Like now, you know, so it's more, and so then you change the question to how can I get better? What are the steps I need to
how
take?
do I get uncommon healing? How do I not
Mm,
become one of those statistics, right? Because most people
mm,
go into a doctor's office and their doctor tells them there's no cure for this. This is going to be a lifelong illness, right?
mhm,
But most of them are not aware of what supplements are available, right? Their only mindset is, let me think of the prescriptions I could potentially give this person, right? That's how
mhm,
Western medicine was created, right?
mhm.
So, and I'm Western medicine trained. I'm a surgeon, right? I'm not telling you just abandon all of those, ideas. But what I am saying is that there's a whole nother piece to this whole puzzle, and that's, natural supplements, superfoods, things like that. And I think if you kind of understand that our knowledge of these types of diseases, if we fast forward 20, 30 years, we're probably going to all be getting these types of educational programs, right? On how to fix it. Like, look 30 years ago, diabetes, right? Diabetes never had an educational program. People were just started on insulin. They said, oh, well, like, tough luck, Now we
Mhm,
have diabetes education. We have tons of stories, like hundreds, thousands, millions of people that have reversed diabetes within a few months, right?
mhm.
Very doable, right? And it's those same 5 pillars: diet, digestion, sleep, stress, and exercise. It's more geared towards diabetics and low glycemic index folks, right? But the point I'm trying to make is, I think there's going to be an evolution in medicine when it comes to these inflammatory disorders, and we're going to stop thinking about them as something like that needs a pill to fix or treat a symptom. And I think we're going to start thinking about them in terms of inflammatory pathways. I think we're going to start thinking about them in terms of what phytonutrients, and you heard me talked about that before, but what superfoods are deficient in the diet,
Mm,
right? And we live in a society where there's a lot of these things deficient in the diet. So your option is either to fix the diet, which everyone should do,
mhm.
and or right, add some supplements, right? So if you're not
Right.
getting something and you just continue to not get it, or maybe you're getting some of it but not enough, right?
Mhm.
That's where the supplementation piece really comes in. And I think it's very important when you're looking at supplements to understand. I was invited to Stanford a year ago. I think that we did a
Yeah.
podcast at the time. The talk is up somewhere. It's called like University Medicine something. You can look it up. But um, I basically subcategorized these nutrients, right? These phytonutrients into 8 categories. And the reason I made I developed this sort of system was so that when people try to see like, hey, what supplement should I be taking? They're not taking like multiple items from each one of those lists, right? I don't want there to be redundancy. Like, for example, I just did an intake assessment with a gentleman yesterday, and I was looking at his supplement list. And on that supplement list, I'm seeing things like fish oil, right?
Mhm.
Okay, great. Everybody likes fish oil. I'm seeing another one that says RALA in it, which you probably don't know it, but it comes from like walnuts and things like that.
Mhm.
RALA and fish oil both have omega-3. So
Mm,
now he's taking 2 things with omega-3 in it, right?
mm,
And he's wondering why he's got lower GI bleeding, but well, it's a blood thinner, right? And so
mm,
and I was further looking through his supplements, and I found that another one had some other omega-3 in it. So
mhm.
he's got like 3 medications, or not 3 supplements, where it's just like redundancy built in the system. So I wanted to kind of review some of my top favorites, if if you're willing to
Yeah.
entertain me, on
Yeah.
this. And the reason I love your brand is because you actually care about what the ingredients look like. You do testing. You don't get like you're not getting cheap stuff. You're getting top of the line stuff in each category. And so I send a lot of folks to your store. I'm really excited by some of these other items. I know like everybody goes for your super greens or your super reds, right? But I'm actually more interested in those other ones, those like, those little individual ones. And I'm hoping we can touch on a couple of those if
Sure. Yeah, absolutely. Yeah. Yeah, we do a lot of, and that's one of the things, like we do a lot of single ingredient products. I don't really sell, I'm not like a big multivitamin guy, because like a lot of these multivitamins are just tiny amounts of like sprinkled in whatever, or like mostly B vitamins, but then like sprinkled in.
subtherapeutic, right? They
Yeah.
don't, it's like you have a little bit of it, so they count it, but you can't count it because what you need is an actual therapeutic dose, right?
Right. Right.
And the other cool thing about some of the peak performance supplements is that they'll go after like a targeted problem, right? So you've got stuff for like cholesterol, you've got ones for glucose management, right? These ones are phenomenal because then you're not left taking 3 pills for the same problem, and you're getting therapeutic doses of all 3 items or 2 to 3 items, right? That actually makes sense, right? Like it doesn't make sense to have like a cholesterol thing with that also has glucose support in it, or a multivitamin that also happens to have a little bit of like other stuff. Like it just kind of, it doesn't muddy the water, right? It makes things very cut and dry, I think.
Yeah. It's like you just take these multivitamins, then you piss out neon yellow, and you're like, what was even in here? Like,
What
really
happened?
weird. Yeah.
It's funny. So I know you have a product, citrus bergamot and red yeast rice, right?
Yep.
And I have a few folks in my clinic that have had high cholesterol. And the citrus bergamot, I'm telling you, if you look at the data, it actually will decrease, like the Bergamote brand, I think and they're like some of the top of line stuff. And I think that's the same stuff that you've got in your formulas. So they have almost a 11 to 12% reduction in LDL without any increase, without touching either the triglycerides or the HDL, which is amazing, right? I mean, statins will give you anywhere from 20 to 30%, but statins also have a side effect rate of like 30 to 40%. It's like, it's astronomically high. Okay. And if you look at like all cause mortality, some of these other metrics, like statins, some of them have never even panned out from that perspective. So I love your citrus bergamot red yeast rice product.
I mean, those are two, again, I was taking those both individually myself, and I'm like, can we just make one that has both of them? And like, and now you get a good dose of both of those in one. We could power through a few more of these if you want real quick. I don't want to spend the whole time talking about individual ones, but
I don't want, this is not a plug for your brand. I'm just really interested in a couple of these items, and I just wanted to go through them real fast. And rhodiola, for example, you have rhodiola capsules. Rhodiola is great for boosting the immune system. So around the time that people get sick, I actually have an immune tea that I recommend to a lot of people that has a ton of rhodiola in it. And it's great. It's just phenomenal. You have
plug your teas, man. Your teas are amazing. I forgot about them.
Oh yeah. Well, you call them my teas. I had a hand in helping formulate them, but they're on a website called Physicians Trust. So it's phytrust.com, phytrust.com, phytrust. And they're phyto teas. And there's only the guy that actually created it was a guy that had Crohn's disease. He had Crohn's disease 50 years ago, and he was at Robert Wood Johnson Medical Center. They wanted to do an operation to remove it. And he said, no thanks, right? This guy's a respiratory therapist, has a medical background. And what he did was he studied under a very reputable traditional Chinese medicine guy up in Princeton, New Jersey. Okay. And so and then he spent some time in like the Native American reservations, learning a lot about how they treat certain problems, or like the herbal medicine. So this guy is not only very well trained from a Western medicine perspective, he's like one of the top RTs in the state, right? But he also knows a lot about individual herbs and how to mix them up into various concoctions. So, he's been disease-free for 50 years, never took a medication, and has had quote unquote Crohn's disease, inflammatory bowel disease. And he created a digestive tea, and he created a immune tea, basically for people with digestive dysfunction and autoimmune, right? And so, one of the ingredients he uses is rhodiola. And unfortunately, I had time to spend with him almost like during the pandemic, almost 2 years, just really working with him to try to perfect um, some of these ingredients and some of these, uh, the teas. And it's a 4-gram tea bag. It's this big, right? Because as you know, dosing matters, right?
Mm-hmm.
Those other tea bags you buy at the store are this big, right? And they're designed for multiple steeps, and they're designed so you can have like 2 or 3 of these dosings per day, and they
Yep.
taste great too, by the way.
They're amazing. They're amazing. Yeah. So
Yeah.
what are some other what are some other superfoods?
So
And
I'm a huge mushroom fan,
okay.
right?
Yeah.
Huge mushroom fan, right? We're talking reishi, cordyceps, lion's mane,
Mm-hmm.
love it, love it, love it. Chaga is amazing.
Mm-hmm.
It's hard to find good, like really reliable places to get these, because what ends up happening is some of the brands, they'll say it's chaga and it's an international kind of thing, and like you
Mm-hmm.
really need something that's US based, and you need something that's been tested for these active ingredients, which this is why I like your label.
Yeah, we have a great source. Yeah.
Yeah, and it just makes sense, right? You're doing the testing, you're checking to see that it's actually something good and will work, and so that's great. Beetroot, man. Like I juice beets, I blend beets, but a lot of people don't even get enough beets, right? And beets have betalain in it. They got all kinds of stuff, and everybody's paranoid about heavy metal toxicity with beets, and so you need something that's a U.S. grown source. You need one that's heavy metal tested. So beetroot capsules are amazing.
Yeah, we sell a lot of the organic beetroot powder. We have beetroot capsules as well, and I actually have one coming out in the pipeline here, which I'm kind of going to call it like beetroot candy. They're like chewables, but they don't have any. They're sugar-free, gluten-free, the whole deal. Just kind of like a tiny bit of like sweetener in there, just to
Yeah.
make it taste like candy. And like, dude, I pop one of these like every time I have a workout. Like before
Mhm.
I pop one, I chew it up. It tastes amazing, and like. Yeah, so we got those coming too. I'm really excited about those.
The last one I want to talk to you about, and this is something I actually added to my regimen, was the nicotinamide supplements and the resveratrol, right?
Mm-hmm.
There's some data to suggest that depending on the dose you take, but you can increase your telomere length by a substantial amount. Telomeres, as you know, are those like little codons at the end of a chromosome that tells the chromosome when to die. Some people, like David Sinclair, some of these like
Mm-hmm.
folks think that the length of the telomere will dictate the lifespan of the cell, which there's good data to suggest that. The problem is like some of this data is like they don't know, right? They haven't compared people that have taken these supplements to not and seen how long they live. You're never going to have that study, right? That study will never exist. But they do have studies where it shows like, nicotinamide, for example, in the NMN, right? If you supplement it, then it increases telomere length,
Yeah. Yeah.
Resveratrol was made famous by Dr. Oz, but actually, if you take out all the marketing behind it, it's one of the most powerful polyphenols, right? It's found.
It's why I think why red wine got the reputation of being like good for your health. It's like, well, it's actually just the resveratrol. You could just take it in a capsule and skip the alcohol and probably, again, whatever. If people do your thing, but yeah, it's a resveratrol that you could take in a capsule, without the alcohol for me, which messes me up. So
Yeah, I'm not so much into alcohol. Maybe, I mean, if you talk to me in my younger days, like there's a whole
sure,
different
me too.
story. But nowadays, I'm like, man, I don't know if it's worth it. A lot of.
I honestly, I'll be honest with you, I'm trying to go the opposite way because I haven't drank in over a year. And like, I'm like, man, sometimes I want to have a drink with my wife or something, just like on a date night or whatever. And I'm thinking, am I too fragile? Because like, man, just the last few times I drank, it just like I did not feel my normal self the next day. I couldn't go to the gym really. And it's just not worth it. But at the same time, I'm like, maybe I should do it just to make myself a little anti-fragile and have fun with my wife once or twice a year or something. So yeah, we'll see how that goes.
Yeah, we gotta introduce you to low alcohol content wine, maybe. Or something.
Dude, I ordered these special wines. I think they were called dry farm wines. They were like low sulfate or from organic farms, and this, like the whole deal, supposed to prevent the hangover, and like still didn't happen for me. I don't know what it is.
At the end of the day, what alcohol does is it causes inflammatory reaction in your liver, right? It's actually one of the most common causes of fatty liver, right? You get it from alcohol. And so, taking things like N-acetylcysteine, right, which is
Hmm.
basically
Hmm.
it regenerates glutathione, it regenerates some of these enzymes in the liver. It can counteract the effects of alcohol. Most of the hangover is from the aldehyde form, right? And some people are slow metabolizers, as you know. So I think there's some variability in that, and I don't know. I don't know if the answer is drink more alcohol so you are less fragile, or if the answer is maybe just don't drink. I don't know.
Yeah, I don't drink, but I was just thinking like once a year, just to like, I don't know, we'll see. I probably won't do it. I can't bring myself to do it, I don't think. But I have started taking. We started selling NAC, N-acetylcysteine, and
Oh, okay.
yeah, yeah,
So
we
you've
started
got
selling
that
it
in your
recently.
line too.
It
That's
was,
wonderful.
it's interesting. Both NMN, also, just kind of heads up for people listening. Actually, David Sinclair, came out with a great book, kind of helped popularize NMN. But unfortunately, now he's trying to patent NMN and not let anyone else sell it. And so there's a little bit of an issue. If you see it sold out on the website, it might be because of that. We're still trying to figure out what's the actual rule here with what he's doing. The same thing actually happened with NAC. NAC was taken off of Amazon and taken offline for a while, but then a year later they brought it back. So we came back out with it now. So yeah, hopefully the same thing happens with NMN soon.
Yeah, I think NMN, there's believe it or not, there's like 5 or 6 ways you can synthesize it effectively, right?
Hmm. Hmm.
And they're not actually, they're patenting some of the synthesis methods, but you can
Uh-huh.
get, like, for example, there's other forms of nicotinamide that are just as good, just as active, but they're a slightly different salt, right? And you can find those online too. So I don't see nicotinamide going away. What I think is
Yeah.
probably going to happen, the market is going to diversify, and you're going to get you'll have these you'll have a bunch of sellers with like slightly different ingredients, and what they're going to do is they're going to say, hey, my way of synthesizing is a little bit better, right? Which,
That's exactly right.
everybody's going to say that about their own thing, but I think that's how the market's going to end up on that. That's what I think is going to happen. But
Yeah. Yeah. Well, let me ask you this. Like, I want to also touch on, rather than just supplements the whole time, I do
yeah.
want to touch on, like, number one, what are some general things that you tell people who come with the autoimmune disease that have inflammation? And, we've given in-depth sleep tips. So we could, we talked about sleep, but more in terms of like diet or lifestyle. And then also, like, we're talking about these superfoods, but why are these superfoods, why are these phytonutrients actually important?
Yes. So a couple things. Let me answer the first question. The first question is, what do I recommend for folks? I came out with a book. It's the Phyto Diet, and I basically put these benchmarks of what I think people should be eating each day.
Hmm.
Right. And I'll summarize some of these things, right? I think people should eat anywhere from 8 to 12 servings of green leafy vegetables. Now, you would react to that and think, wow, that's a lot of vegetables, right? But, keep in mind the serving is just like a fist size, right? So,
Hmm.
and veggies, they don't actually make you they'll fill you up, but they won't make you full, so to speak. So we're only
Hmm.
talking about 2 to 3 dinner plates. Okay.
Hmm.
And then I want people to get, like, the other categories in there. So, use spices to get your alkaloids. They need about 4 servings of phyto oil. So we're talking omega-3, 6, 7, and 9. Okay.
What kind of spices do you like?
I like anything that doesn't have salt in it. And, I'm Indian. So, we got all the spices. We got the best spices, right? So you can think asafoetida is amazing.
Hmm.
If you don't know what it is, another word for it is hinge, Hinge, hinge. It's a great little, it can bring out like a Mediterranean taste in most things without the
Never
use of
heard of that.
salt.
But like
Yeah.
oregano, basil, and all that kind of stuff.
Yeah, those are like the white people spices, right? So the European spices, which I use a lot of that. So
Right. Well, all right. Like turmeric and
well, yeah,
yes, yeah,
turmeric, curry
yeah,
powder, bay
yeah.
leaves, cardamom. We use cloves. We use
Uh-huh.
coriander. Coriander is very big in both South American, Latin American cuisine, as well as Indian cuisine.
Hmm. Hmm.
There's true cinnamon, right? So we're talking Ceylon cinnamon,
Yeah.
nutmeg is great. There's a lot. There's so many,
Yeah.
and I would even suggest people get more educated about the types of spices that they can use, because if you think about it, if you use enough of those spices, you won't miss the salt. And unfortunately, like a high amount of sodium in the diet can cause problems. And I think even just, 2 grams, in my opinion, probably way too much. I think it should be right around 500 milligrams for most people.
This is an interesting one. This is one that's a little controversial. I wanted to say for
It is.
those who talk about for those who don't know specifically, when Chano is talking about phyto or phytonutrients, those are basically plant-based nutrients. Hopefully, you know that. The
Plant-based
salt one,
micronutrients, right?
plant-based micronutrients, yeah. And the salt one's an interesting because a lot of people, in fact, I think one of the last ones, she recommended Celtic salt, and that's what I kind of use on my eggs or fish or whatever. And I think it kind of depends though, right? If you're eating like a paleo low sodium diet and you're doing saunas and hard workouts and sweating a lot, that's going to be different from someone who's
Correct.
sedentary and eating bread and pasta, right?
Correct. One of my famous friends and clients, actually, Stan Efferding. He's a world class. He's considered the world's strongest IFBB pro. He's like a bodybuilder, right? He actually recommends salt tablets, right, when you work out, because when you work out, it's a whole different metabolism, right? But you had asked me, the original question you asked me was, what are some of the inflammatory pathways that I'm trying to fix, right? So with salt, there's an inflammatory pathway called Th17. It's T helper cell 17. So it's an inflammatory pathway that's activated in some folks with autoimmune disease, right? And so eliminating salt in the diet for those people is probably a good idea. Now, these people, as you know, are not doing a whole lot of exercise. They're not doing a whole lot of saunas. They may have high blood pressure issues. So their salt intake may be supra-physiologic, meaning way too high. And I would say, and if you were, I live in Vegas. So if I'm a betting man and I took the US population, I would say most people are having probably too much salt. Okay.
Yeah.
But I agree with you. I do think it's a subtle point, and it's worth mentioning that there are certain circumstances where that the recommendation would not hold true, right?
Yeah, but no, you made a good point. You're talking about people who want to lower inflammation. They're coming to you with an issue, so you're addressing all these different pathways. Yep.
Correct. And then, so the other ones, right? So we have the arachidonic acid pathway. This is a huge debate, right? Everybody talks about processed meats have a high amount of arachidonic acid. We're talking about the IL-6 pathway.
So processed meats that people should stay away from are like cold cuts, like stuff like that, bologna, salami stuff, or what?
Yeah, so it has to do with so the arachidonic acid is found in animal cell walls, right? It's created through the cholesterol, right? And if you compare something like a grass-fed meat versus like a processed meat or one that wasn't grown appropriately, right? Then you will look at the GLA content. The GLA content is the gamma linolenic acid. It's an omega-6 fatty acid. It's actually good for you, okay? What ends up happening is some of these fatty acids and some of these cholesterols, when you get these meats that are a little bit low quality, can increase arachidonic acid, which is a huge problem because the arachidonic acid pathway is responsible for things like lupus, ANA positivity, rheumatoid, inflammatory bowel disease.
So you basically tell people stay away from all meats unless it's like a grass-fed or something like that?
So in my regimen, I'm not restrictive, right? My diet is not one that's very restrictive. I'm always like, let's add on phytonutrients first. Now,
okay, interesting.
And it's a gradation, right? So if they're in the pro-inflammatory state, right, which is generally the first 6 weeks, we're very tight on where they can get their meats, right? I know I've eaten at restaurants with you. I know you only ordered like the wild caught salmon, right? With like minimal to no seasonings, right? Some lemon on top and you're happy, right? That's meat, right? And that's not something I restrict. And there are ones that are fine, right? But I am very specific, right? I say, it's very hard to find sourcing on some of these things. It's better to err on the side of not doing these for the first 6 weeks. After the first 6 weeks, when people are out of the inflammatory state, we liberalize these parts of the diet, right? And so we bring things in that we think will be okay, like for example, some of these grass-fed items and things like that, and then see how they do, right? I think it's important, and it's a totally different recommendation if they're fitness training and doing other things. So I just want to be very clear about what I'm saying. Like the recommendations are different based on where they are in the inflammatory cascade.
Mm.
If they're super pro-inflammatory, we make different recommendations. If they're like training, I mean, I've got, you know, one of my patients, the one who beat Crohn's, he's a bodybuilder, right? So he's on one of my, you can find him, bodybuilder beats, you know, inflammatory bowel disease. Just put it into YouTube, you'll find that video. But that guy, like, you know, he's eating stuff, right? And so, and then, so, you know, we covered 2 of the pathways, right? There's also the histamine pathway, which I've discussed at length. We have discussed at length on this podcast. It's mainly, people think histamine is coming from environmental exposures like toxins, like allergens and mold, right? Those are the triggers, okay?
Mm.
But the thing actually producing the histamine are the gut bacteria, right? And what promotes this? Sugar and simple carbohydrates are the biggest drivers, in my opinion, of bacterial overgrowth and histamine production. I think people with allergies, if you take their diets and you make it more low glycemic, their allergies actually get substantially better, right?
Yeah.
And they still have.
Dude, I even used to be crazy allergic to cats as a kid, like crazy allergic. The last few years when I've been in people's house that have a cat, I'm like nervous. I'm like, oh shoot, I hope I'm not going to get itchy and like watery. And like, I've actually been fine. And I'm just like, holy cow, like this is incredible. Like, I hope it stays this way. I'm still kind of afraid, but I'm like compared to how I used to be so bad as a kid, like I couldn't go over someone's house who had cats. It was crazy. So yeah, I mean, I think it's a diet for sure.
Yeah, and then you know, you got other things like you know, IL-6, TNF alpha. Okay, that's another very common inflammatory pathway. That's where you get the benefit from resveratrol. That's where you get the benefit from polyphenols. You get the benefit from like things like broccoli sprouts, you know, things like that. That really affects that chlorophyll. Okay, chlorophyll is a big driver of that kind of inflammation. And then you also have just oxygen-free radicals. Okay, this is more subtle, okay, but oxygen-free radicals, you get that when you eat a lot of carbohydrates, you get that when you're stressed, you get that when you're, you know, when you have a disease process like autoimmune or even cancer, right? And so you have free, and then so you have to consume what are called scavengers, right? So free radical scavengers. So things along those lines are like celery juice, chlorophyll, nicotinamide actually, and acetylcysteine, you know. And so and you can get a lot of these from the diet, and sometimes diet can make these things worse, right? So there's certain foods that make these things worse. So we focus a lot of our energy and attention on these known pathways with a lot of good data behind them, right? And then we basically create a custom diet plan for each one of these individuals with like a custom supplement plan to make sure that we're going to shut down as much as possible some of these inflammatory pathways, and then see what happens to the autoimmune disease. Well, we know what happens. The digestive dysfunction goes away. The autoimmune dysfunction goes away. I mean, and it goes away pretty fast. It's not like something you got to wait long periods of time for. I mean, it's
amazing. More people aren't talking about this. It's crazy because there's so many people suffering and just thinking that they're going to have to live with this their whole life or whatever. It's incredible. I'm so happy for the work that you're doing and how you're spreading this knowledge. I wanted to ask you one thing I've noticed recently, like, what about like vegetables, raw versus cooked? I find that when they're cooked, it's much easier on my stomach, specifically broccoli, for example, like raw broccoli versus like, you know, steamed, you know, cooked broccoli just feels way easier and lighter on my stomach. I don't know. I was just curious your thoughts around that.
There's great data on this. Actually, Dr. Rhonda Patrick has an entire she's got an entire video dedicated to this. I touch upon this also in my series. Broccoli has this thing called sulforaphane. You heat it up and it will deactivate another enzyme called myrosinase, which will convert this into like the active form, right, in the body. So what I tell people is there's a temperature at which you lose phytonutrients, and phytonutrients, they come in all categories, right? You got polyphenols, you have phyto oils, you have terpenes, you have chlorophyll, right? And there's like 8 different categories, right? So these phytonutrients will degrade when it's exposed to temperature and time under that temperature, right? So the cutoff seems to be anywhere from 160 to 180 degrees. Okay. And the cutoff is around 6 minutes. Okay. That's plus minus 2 minutes, so 48 minutes. So if you look at some of these people that are very in tune with autoimmune or anti-inflammatory cooking methods, they'll suggest low heat, right? And they'll suggest doing it for like not a lot of time. So, and even using steam cooking or some water in there to try to cook it so the temperature doesn't go too high for a substantial amount of time. Think about this, like when you cook spinach, right? Like, well, let's take a raw spinach and you cook it. There's a point where it gets like just crispy, but just soft enough that you can eat it and it still retains its color, retains everything. That's like the sweet spot, right? You have a little bit of denaturing, but not too much, right? It's palatable. And then it gets to the point where it's withery. So, you know, like some of it's kind of coming down, and then it gets to the point of being brown, right? Well, when it's brown, it's, you may as well not eat it at that point, right? There's no point. Right. Fully oxidized, everything is gone. So broccoli is kind of on, broccoli is more robust. Okay. You can do a little bit more with it, I think. But obviously, you know, if you can eat it raw, if you can tolerate it raw, great. But if you need to just do some low heat cooking for, and we teach those methods, actually, there's an entire section in my course about how, like anti-inflammatory cooking methods, right? Nice. How to preserve these phytonutrients. Another big one, right? Another big one is phyto oils, right? So olive oil, for example, right? Even if you heat it up, even if it's below the smoke point, it'll still denature the omega fatty acids and turn them into trans fats, right? And turns them into saturated fat. So it turns a good fat, olive oil, into a bad fat, right? Olive oil is the most resistant, I think. It's one of the more resistant fats to cooking. But ideal situation is you cook with as little oil to begin with, right? And then you add the oil to the end of the, you know, after you're done cooking, right? So then you've preserved all the phytonutrients. Another big one, black coffee.
If you were cooking eggs, what would you use would you butter the pan? Would you use butter?
No,
would you use olive oil?
I'd use a green pan, and if there's no plug there, I'd go get a green pan or a ceramic pan. Okay. And then I would just put the egg straight up on there, low heat. I'm talking very low heat. We're talking like a 2, maybe a 3 on the thing. Let it cook out, and then you have your egg. You're done.
Oh, it doesn't. I have a green pan too, so I don't need to put any olive oil or butter or anything on there.
Green pans work really well with low heat. They don't stick as much. The minute the pan gets a little scrape or a little oil buildup on it, then it loses the nonstick. So to preserve the pans for longevity, you shouldn't probably be cooking over 4 or 5 in general. And I'm sure when you first bought the green pan, you were cooking eggs all the time, no problem, right? But now maybe the edges where there's a little oil spilled there and not cleaned off, those tend to be a little bit less nonstick, right? And
okay, I'm gonna try that.
Great. They're ceramic, they're not traditional nonstick, and you're worried about all the Teflon stuff, you know? So.
Right, yeah. All right, I'm gonna try that. I also do think in general, right, like even when they talk about meat, like it's funny, right? If you talk to someone who's like really hardcore vegan and they're like, you know, meat is bad, and it's like, okay, well, was it grass-fed meat that they did a study on, or was it, you know, some really nasty processed meat where they had to, you know, shot the cattle with antibiotics, right? Was it cooked on high heat, or was it cooked on super low heat, right?
Or raw.
Right.
Yeah, and here I'll add one more variable to that. Was it a high glycemic diet or a low glycemic diet? Because it turns out, like, you know, a lot of I get this question a lot on my YouTube channel, is like, oh, well, I fixed my disease using a paleo diet or carnivore, or I hear carnivore diets work. Well, yeah, great. I mean, if you want to do it that way, fine. The reason these diets work sometimes is because it's not because of the meat per se, it's because of the low glycemic index of the diet, right? Meat plus sugar causes problems. Meat minus sugar probably can fix most people, or a lot of people, right? At that point, right? It's just really hard to do perfectly. Meaning, I see a lot of people that have sort of like done it part of the time, or done it like, I guess what I'm saying is there's less room for error with diets like that. There's no room for error, because the minute you eat a little bit of anything with carbs in it, it kind of ruins the whole effect, the whole benefit of the diet, you know? So I tend to recommend diets that are a little bit more sustainable, a little bit more balanced, right? I'm not like hardcore one way or another, but
you know, I think it's important to make it sustainable.
That's the key, right? If this isn't something that you can reproduce in your own day, then it's not going to work, right? We could say all kinds of stuff like, hey, do this crazy thing, but if most people can't do it, then most people won't succeed, right? And so that's where that's how I make some of my recommendations.
Nice, man. Well, man, this has been amazing again. I'm going to have to get you back on for a fourth time at some point here
Sure.
soon. But tell people about, I'm sure people want to know, if them or one of their loved ones has some autoimmune disease or some kind of chronic inflammation or something. Where can they find you and learn more about
Yeah,
this?
they can come work with me directly, and to book, and I offer discovery calls where I'll just kind of tell you about the program. You just go to mgiclinic.com and then sign up for a discovery call. It's very easy. It's about 15 minutes. And I'll go into the program, and I go into like what I do for folks, right? The first week, we're resetting people's microbiomes using a patented probiotic. I'm reviewing folks' medical records, right? So I always like to see what was missed. There's usually some big thing that was missed in terms of testing or follow-up and things like that. So that's a really key kind of and that's like the intake assessment, right?
Mm-hmm.
Then they meet with my team. So I've got a few people on my team, one of which, I have one of my former patients, actually, she's now a health coach, and she beat autoimmune like a year ago, and she's been a pro at the diet sort of thing. So she'll help like kind of make sure your diet and supplement regimen is tuned up. And I recently brought on board a trauma awareness coach. And this is someone I've personally worked with, and someone that's helped me substantially, and she's amazing. She's probably the best at what she does. She actually she's developed a program for people that have had inflammatory disease, to identify how these sort of, and trauma with a lowercase t, capital T, whatever you want, right? How this dissociation from oneself, or this inability to prioritize your unmet needs, how it drives a lot of these inflammatory changes. She's really good at teasing that out. And those sessions all happen within the first month of the program. So you're doing all this stuff. And and obviously you're enrolled in the academy, right? So there's 15 videos you got to watch. You get access to the protocols on day one. So you can start like literally the day you sign up. So it's really good. It's a tremendous value. I think most people are very happy with the results that they get. It's very popular. I'm getting a lot of signups, so
I'm so happy you're doing it, man. I'm really happy, and you're addressing the physical and the mental part, which is really amazing. And yeah, man, thank you for doing what you're doing, man.
Yeah. And thank you to Laura for inviting me again. I know we always have like some really great discussions. And I think that the reason this podcast has become so popular is you have real people on here and they're talking about real things, and it's actionable information, right? We're not talking about some theoretical sort of pie in the sky sort of thing. Like, you present solutions for everyday people to just do better and improve their health. And that's kind of all of our focus. That's what we do. And so thank you.
Amazing. Thank you. Yeah, man. The Peak Performance mission is to inspire people to prioritize and transform their health. So love bringing people.
It's a great mission.
Thank you. Yes. And you're doing the same. So yeah, man, really appreciate you. We need to hang out again soon. And thanks for coming on again.
I appreciate it. Be well.
You too. Thanks for listening. And just a reminder, if you haven't yet tried any of our Peak Performance products, you get 20% off your first order. We have one of the largest selection of USDA certified organic superfood powders, as well as very high quality supplements. And you get 20% off your first order at buypeakperformance.com. That's www.buypeakperformance.com.